Hello everyone, this is Dr. Simone Atkinson, and today we are going to study cleft lip and cleft palate. A 6-month-old infant is scheduled for sequential repair of her cleft lip and palate, and her past medical history is unknown. Her mother brings her to the same-day surgery unit for her preoperative workup. And during the workup, it becomes apparent that the care of the child with a cleft lip or a cleft palate requires a multidisciplinary approach. What types of multidisciplinary team members are needed for the care of an infant with the cleft lip and palate? Well, there's the surgeon, the pediatrician, a dentist or orthodontist, a speech-language pathologist, an otolaryngologist or an audiologist, as well as a social worker. So why is a surgeon an essential part of this craniofacial team for an infant with cleft lip and palate? Well, they're needed to address the surgical repair of the defect or defects of the child. So why is a pediatrician an essential part of the craniofacial team for an infant with cleft lip and palate? Well, they're going to be needed to address the overall health status of the child. So why is a dentist or orthodontist an essential part of the craniofacial team for an infant with cleft lip and palate? Well, they're needed to address missing or malpositioned dentition, as well as to ensure there's no interference with speech or feeding in the future. Because children with cleft lip and palate, they often have challenges because of their missing or misaligned teeth, and that can affect their speech as well as their feeding. So the dentist or orthodontist are part of the multidisciplinary team because they can address these issues to support the proper dental development as well as improve the speech and the feeding capabilities of these children. So why is a speech-language pathologist an essential part of the craniofacial team now for this infant with the cleft lip and or the cleft palate? Well, they're here to address compensatory speech patterns because these patterns are usually related to the cleft lip or the palate. So compensatory speech patterns are common among children with cleft palate, and the patterns that they develop as a child, they're trying to compensate for the gap in their palate, and it's affecting the way that they produce sounds. So to address this, the speech-language pathologists are definitely an essential part of the multidisciplinary team. They work with the child to correct the patterns and improve their speech clarity. And by addressing the compensatory speech patterns early on, they can help the children communicate more effectively as well as reach their full potential. So on to the otolaryngologist or the audiologist. And why are they an essential part of the craniofacial team as well for the infant with the cleft lip and palate? Well, they are here to address eustachian tube dysfunction and hearing loss. Children with cleft lip and cleft palate often experience eustachian tube dysfunction as well as hearing loss. And this is because the gap in the palate can affect the function of the eustachian tube, and that leads up to fluid that's built up in the middle ear and results in hearing loss. So to address these issues, the otolaryngologist or the audiologist, they assess the child's hearing and they provide any appropriate treatment to help prevent the complications. And by addressing the eustachian tube dysfunction as well as the hearing loss early on, they can help ensure that the children have the best possible outcomes and best quality of life. Now, why is a social worker an essential part of this craniofacial team for the client with the cleft lip and palate? Well, it's clear they're going to provide social support. The craniofacial team will include a social worker. They will help the families navigate the emotional as well as the financial challenges of caring for a child with a cleft lip as well as a cleft palate. And by offering their guidance and resources, the social workers can help empower the families to cope with the condition effectively as well as help them to thrive. Now, why is it important to determine the infant's current health status before scheduling the surgery for the cleft lip and palate repair? Well, we want to assess any signs or symptoms of illness or medical problems since birth, and this is to ensure the infant's overall health status before they have the surgery. Next, we want to assess the infant's current diet as well as their feeding style, and this is also important to determine their nutritional status and identify any feeding issues that could affect their surgery as well as their recovery. Why is it important to perform a Chem 7 test before surgery for cleft lip and palate repair? Well, we want to determine the fluid and electrolyte status, which is crucial to assess the infant's hydration as well as to ensure they have a proper balance, especially before surgery. And we want to assess for any chronic malnutrition and anemia. Also important to identify nutritional deficiencies that may affect the infant's overall health and recovery from the surgery. What does a urinalysis reveal before surgery for this client? So the presence of a urinary tract infection would be important to identify. This can indicate that there is an underlying medical issue in the child, and this has to be addressed before surgery. Additionally, an untreated UTI can cause more risks and complications during as well as after the surgery. So why is this CBC now important before surgery for cleft lip and palate repair? Well, it's important to assess for hemoglobin and hematocrit levels, and this will help us to identify if there is any anemia, which could indicate chronic malnutrition in the child. So this assessment helps to ensure the infant is healthy enough to undergo the surgery so that they can recover well afterward. Now, what will you include in your preoperative teaching to the infant's parents regarding the postoperative care? First, the admission to PACU as well as the discharge home. So the parents need to know where their child will be after surgery and what to expect during the transition to home. They also need to know about pain management. Parents need to understand how to manage the infant's pain effectively to ensure that they're comfortable and that they can facilitate their feeding and their hydration. Feeding instructions. So parents need guidance on how to feed their infant post-operatively, including what types of foods to offer and how to ensure proper nutrition and hydration. Then the surgical site care. So parents need instructions on how to care for their infant surgical site and ensure that they're preventing infection as well as promoting healing. Now, why is it important to keep the infant comfortable after surgery? So first, decreasing stress and crying. This is important because it's going to help reduce any tension on the surgical site, and that's going to obviously promote better healing and minimize any risks of complications at the surgical site. Next, we want to have successful feeding and hydration of the infant, and decreasing their stress and their crying will allow them to feed and hydrate and help them to recover well after surgery. So what feeding instructions will you provide to the infant's parents after surgery? So first, feeding with a syringe or a special cleft bottle. This is going to help to prevent stress on the surgical site, and it'll help facilitate successful feeding while the infant's palate is healing. Then feeding should also only begin once the infant is fully awake, as we want to ensure that they are alert and that they are able to swallow safely. Now, breastfeeding, this can be allowed if it's applicable, but due to the unrepaired palate, it is often not possible because it can lead to air that's going to enter the nasal cavity during the feeding time, and that's going to increase the risk of complications for the child. Now, why might the infant return with elbow restraints after surgery? Well, using elbow restraints will prevent the infant from rubbing or touching the operative site, and that could disrupt healing or cause injury. So in the same light, this is why the prone positioning should also be avoided in these infants, because that'll prevent any pressure on the surgical site and help to prevent any injury to the sutured area. How should the infant be positioned for feeding after surgery? So placing the infant in a semi-reclined position will help prevent aspiration during feeding. It'll help to keep the airway clear. It'll reduce the risk of any liquid or food entering into the lungs. Also, it's essential to feed the infant slowly with frequent burping. Additionally, using a soft, large nipples, lamb's nipples, prosthetic palate, or rubber-tipped aspeto syringes are helpful with feeding. So what post-operative care instructions will you give regarding the surgical site? So cleaning with normal saline and applying topical antibiotic ointment is normal, and that'll help to keep the site free from infection. It'll help to promote healing. And the topical antibiotic, that further reduces any risk of infection, and it does support the healing process as well. So how can the infant's parents determine daily fluid maintenance requirements and ensure adequate hydration postoperatively? So they need a method to calculate fluid requirements and a way to monitor the client's or the infant's intake. So what they will need to do is monitor the number of wet diapers per day that the infant is having. So calculating fluid requirements and monitoring the intake, this is going to ensure that the infant remains adequately hydrated. And that's really crucial in our small children. And monitoring the number of wet diapers per day, like 6 to 8, that helps the parents assess the infant's hydration status, and it also ensures that the infant is getting enough fluids. In addition to 6 to 8 wet diapers daily, now how can the infant's parents ensure she is adequately hydrated postoperatively? Well, they will need to ensure the infant takes at least 1 ounce or 30 milliliters of fluid per hour, and that'll help maintain hydration and support the recovery after surgery. So after the infant returned from surgery, the surgeon's notes stated that surgical glue was used to close the incision. And standing postoperative orders include cleaning the incision with normal saline and applying the antibiotic ointment 3 times per day. Now, why would the nurse question an order for applying antibiotic ointment to the incision that's closed with surgical glue? So the nurse should definitely call the surgeon to question this post-operative order about the antibiotic ointment being applied to the incision because of the surgical glue that is used. And antibiotic ointments can cause the incisions with surgical glue to prematurely break down the protective barrier. So applying antibiotic ointment to an incision that's closed with surgical glue is unnecessary, and it can interfere with the healing process. What advice now would the nurse give regarding the delay between the cleft lip repair and the cleft palate repair to the parents? So the timing of the second surgery is generally between 9 and 15 months of age, and this is going to allow for some optimal speech development and palate changes in the infant. Additionally, the time in between surgeries allows for adequate healing of the lip from the first surgery. So what nursing interventions are appropriate for the infant post-operatively? Well, the side lying or the elevation of the head of the bed by 30 degrees will facilitate drainage of the oral secretions, and it will help prevent aspiration of the infant. Splints may be required. That's going to help prevent the infant from putting their hands in the mouth that we talked about, and it'll help them from disrupting that surgical site. You can encourage swaddling or cuddling by the parents because that's going to help calm the infant as well as help prevent them from putting their hands at the operative site as well. And we want to control pain. Pain control is essential because we want to keep that infant comfortable. We want to promote them with their feeding and hydration and facilitate their healing. And if they're in pain and uncomfortable, that will be difficult to accomplish. And then finally, we want to assess for hydration and provide IV fluids if it's necessary. This is going to help prevent any dehydration, especially in that immediate post-operative period. In addition to the head of the bed being at 30 degrees, why is it appropriate to position the infant in a side-lying position post-operatively? Well, the side-lying position will facilitate drainage of oral secretions. It's going to help reduce the risk of aspiration. It'll promote respiratory function, and it'll also help prevent any pooling of saliva in the mouth, and that could irritate the surgical site. Why is it appropriate to use elbow restraints as needed for the infant postoperatively? So, as we said earlier, splints might be required to prevent the infant from putting their hands in the mouth again to disrupt the surgical incisional site, and having the splints will help promote the healing and prevent any complications. So, why is it appropriate to administer pain medications around the clock as ordered for the infant postoperatively? Well, round the clock pain control is necessary initially because that's going to facilitate comfort and feeding of the infant. And the reason is that pain can be distressing for the infant and it can hinder them from feeding and hinder their hydration. So effective pain control will reduce their stress, their crying, and what we're trying to accomplish is not having them put any tension on that surgical site to interfere with the healing. So adequate pain management is going to promote their comfort. It'll allow the infant to feed effectively, and it'll help them to stay hydrated, which is going to be a crucial part of this recovery. So why is it inappropriate to use oral suction with a Yanker catheter as needed for the infant postoperatively? Well, plastic oral suction catheters and tongue blades should be avoided to prevent any trauma to the surgical site. And similarly, straws and any other blunt objects, they have to be avoided to prevent any further trauma or injury to the site as well, because this could interfere with the healing and it'll increase complications for the infant. Why is it appropriate now to maintain strict intake and output for the infant postoperatively? Well, careful assessment of the hydration status after this surgery is absolutely essential. We want to ensure that the infant remains adequately hydrated. Now, hydration should be maintained until the infant is taking sufficient fluids by mouth in order to prevent any dehydration, and this will help support their recovery. What dietary instructions should the nurse now provide to the client upon discharge? So soft or pureed foods are recommended for the first few weeks after surgery to prevent trauma to the surgical site. That's going to facilitate their healing. And by the time the cleft palate is healed, the child is usually transitioned to a toddler diet. And that may include a variety of textures as well as consistencies. Now, if the child is old enough, they should drink or rinse their mouth very gently with water after eating, and that is to avoid any food getting stuck in the palate, and that could cause or lead to further discomfort or infection at the surgical site. Now, why should the nurse advise the client to avoid giving the infant food items with sharp edges after discharge? So to prevent any compromise of the surgical site, soft or pureed foods are what's recommended initially after surgery. And as the surgical site heals, the surgeon will advance the child's diet to ensure that the healing process is not disrupted and to gradually reintroduce them to a normal diet. What signs and symptoms should the nurse instruct the client to report after discharge, and why? So any sign of infection or dehydration needs to be reported. So a temperature over 38.6 degrees Celsius, which is 101.5 degrees Fahrenheit, should be reported. Redness, drainage at the site, increased pain. So all of those should be reported promptly. Now, the prompt reporting is important because it's going to prevent complications. It's going to ensure timely treatment of the infant, and this is just crucial for the infant's recovery and their general well-being after this surgery. Why should the nurse instruct the client to report any signs of dehydration after discharge? Well, again, similar to reporting signs of infection, it's to prevent complications and ensure timely treatment of the client. So they need to report any decrease in intake or any decrease in urinary output, because prompt reporting will allow the early intervention, prevent the dehydration or the complications. As we know, children have a higher risk of dehydration. They have a smaller body size, and they have higher fluid requirements compared to our adults. And dehydration can lead to serious complications, including electrolyte imbalances, kidney problems, organ failure. So again, prompt recognition and treatment of the dehydration will help to prevent these complications, and it'll support the child's recovery. Why might the nurse inform the client now that they may see pieces of packing material in the infant's oral cavity after discharge? Well, the reason is some surgeons use a packing material that's going to slowly dissolve over time, and that helps to support the healing and reduce complications for the client. Now, what the parents need to be made aware of is that if during feedings or they see feedings in the nasal cavity, that could indicate a problem with the surgical site. So they will need to call the surgeon or the primary care physician promptly, because as with everything with our infants, we want to do everything promptly and provide the appropriate management effectively. So that is all for now. Please like and subscribe to the channel and share with your nursing colleagues. I would also love to hear from you. So please leave a comment and let me know what other topics you would like me to cover next. We'll see you in the next video.